So we have a real superstar for our first speaker after lunch. Very courageous leader, colleague and friend of AAPS, Dr. Peter McCullough, who's an internist, cardiologist, and epidemiologist holding degrees from Baylor and Southwestern Medical School. Most of you have read many of the things that he has written. He's a prolific writer. He's published some things in our journal. And we're going to start tonight or this afternoon with a little video, and then he's going to begin his talk. So please welcome Dr. Peter McCullough.
The virus emanating from Wuhan, China is sweeping across the globe.
Something is off.
The disease caused by the novel coronavirus has been titled COVID-19.
What we're being told doesn't add
so
up.
important in this crisis that we in. That people
Congress passes a multi-billion-dollar bill.
There is no cure, no way to treat this illness. All we can do is wait for a vaccine.
All we can do is wait for a vaccine.
There must be a doctor out there who's questioning this.
I'm Dr. Peter McCullough. I'm the Vice Chairman of Internal Medicine. The only chance to reduce the risks of hospitalization is early home treatment. We can beat this pandemic.
Patients actually think the virus is untreatable. There's such a focus on the vaccine. Where's the focus on people sick right now? The pressure to suppress any hope of treatment is extraordinary.
Why the single-minded focus on the vaccine? What is that? What is that about?
That's really going to be the goal of investigative reporters to figure this out.
Unprecedented lockdowns, devastating economic damage, huge violations of personal freedom, families separated from their loved ones, all in the name of a medical emergency.
Things won't go back to truly normal until we have a vaccine that we've gotten out to the entire world.
The hope we have of protecting our communities is to get a needle in every arm.
I am not going to follow what you are suggesting and let the virus slaughter my patients. John, I'm watching what's happening. This is a treatable illness.
I don't think this is a matter of academic debate and confusion. What the evidence shows is that this is an organized criminal enterprise. They call this a business opportunity.
People need to know the truth.
We are witnessing the greatest organized crime in history to the tune of trillions of dollars.
The biopharmaceutical complex is using censorship, propaganda, and manipulation to keep people living in fear. But what we need now is courage. That's it. That's what we need now. Courage. Thank you so much. That's the trailer to our book, Courage to Face COVID-19. There's about half a dozen copies out in front. So if anybody is interested and they want to slip out and pick up one of those final copies. It's a 5-star bestseller on Amazon for 18 months. And with no warning, September 29th, Amazon notified John Leake, who's a Dallas-based best-selling true crime author, that our book was removed from Amazon. It was banned because Amazon claimed that it had offensive content. It doesn't have a single expletive. No hate speech, no nudity, no profanity, nothing. We appealed 3 times. Amazon could not tell us what part of the book was offensive. And then a lot of phone calls, a lot of backroom pressure, social media pressure. 12 days later, Amazon restores the book and says, we made a mistake. Outside of Adolf Hitler's Mein Kampf and a handful of other books, Amazon has never done that, ever, ever. Why is there such censorship of the truth? This book is a true story. A lot of it took place here in Dallas. Some of it took place in France, upstate New York, and elsewhere. What we're witnessing now is unprecedented. It's unprecedented. The House of Medicine is on fire. This is almost like a theme today. We've heard about these really tense, difficult, ethical issues. What we've learned from the House Select Committee for the Origins of the Coronavirus, chaired by Representative Brad Wenstrup, July 11th, 2023 report. Look at the title of it. Proximal Origins of a Cover-Up. Did the Bethesda boys downplay a lab leak? Since when does a government report have these types of words on it? Anthony Fauci, a key player in this, it's clear, orchestrated a cover-up that the virus, SARS-CoV-2, was engineered by US and Chinese researchers in the lab in Wuhan, China. And instead of coming clean and say, listen, some horrible mistake happened and the virus got out of the lab, let's do everything we can to save lives, Fauci organized a cadre of scientists and other regulatory officials to lie to the United States and the world for 3 years and say that it came out of nature. He conspired to conceal a worldwide global health threat. Now, this last week, he just won an award for ethics at Case Western Reserve University of Medicine. You can't make this up. What's going on now, this polarization or just these complete sets of antithetical activities now, we can go one after another. So as I introduced, I'm Dr. Peter McCullough. I'm a practicing internist and cardiologist. My office now is in McKinney, Texas. I held leadership positions in cardiology, worked extensively with nephrologists over the course of my career prior to the pandemic. I've been very focused on the pandemic to do everything I can to help America, help the world through the crisis, including proposing and ultimately promulgating the first early treatment protocol for COVID-19 to help people avoid hospitalization and death, and now doing the same with respect to helping people recover from the vaccines, the first detoxification protocol or something that's constructive for people to do after taking the vaccine. Well, what do we know? In the Wenstrup report, Ralph Barrick at the University of North Carolina, Chapel Hill published in 2015 in Nature Medicine and in 2016 Proceedings of the National Academy of Science, 2 papers that announced that the University of North Carolina, Chapel Hill, the EcoHealth Alliance, and the Chinese together created SARS-CoV-2. It's memorialized in the 2015 and 2016 literature that they created a chimeric virus merging bat and human coronaviruses and clearly showing it could infect and invade humanized respiratory epithelial cells in a mouse model. It's cited in the reports. In fact, in Fauci's emails, Christian Anderson from Scripps and Edwin Holmes from Sydney and others are emailing me back and forth saying, well, how do we cover this up? How do we prevent people from knowing this? It's obvious in these papers. Look at the title of the paper. A Wuhan Institute of Virology 1 virus poised for human emergence. They had created it and it was ready to emerge into human populations as soon as it was released or got out of the lab. The papers are clear. And yet not in a single proceeding in the House or Senate have they actually just pulled these papers up, pulled Barrick up on the stand and say what was going on. So still at the level of activities in Washington, there still is an oblivion to what is going on. Just clarity. So recently, a House of Representatives reached out to me and said, would you come to Washington? You better believe I said, yes, we just have to negotiate the date. But I'm going to hit them between the eyes, and we're going to actually review the papers that were funded by the U.S. National Institutes of Health. The papers say it's gain-of-function research. And it started before the Obama moratorium, so therefore it's grandfathered in. They thank the Chinese for doing the research. They thank Peter Daszak and the EcoHealth Alliance for shuttling the plans for the virus over to the Wuhan Institute of Virology. And they thank Dr. Shengling Li for actually doing the work. It's all laid out there. All we have to do is review these manuscripts, the two at the top. Now, at the bottom is the beginning of the cover-up, including Christian Anderson's paper about the natural origin of SARS-CoV-2, which is a fraudulent paper. And there were 12 of these total. So this is all chronicled in the peer-reviewed literature. What I do is I'm just going to stay within the bounds of the peer-reviewed literature. Why not? Because it's all there. What we know is human body can be infected with 4 human beta coronaviruses. SARS-CoV-2 is a coronavirus that's been engineered, and the engineered part of it is the spike protein. The pink bud or the red bud, the spine on the surface of the virus, it is about 1,200 amino acids, got several glycosylation side chains. It's coded for in about a 444 base pair code of RNA. The genetic code for this spike protein was intentionally manipulated to make this spike protein invasive and lethal to the human body. Moderna had the code to this spike protein years before the pandemic. Moderna had a material transfer agreement with Ralph Barrick at the University of North Carolina, Chapel Hill. Stéphane Bancel, the CEO of Moderna, has been questioned by Rand Paul and the committee in the Senate, and yet they never asked him about the material transfer agreement, let alone asking Bancel what did he do in 2007 to 2011 when he was the CEO of bioMérieux, the French company who built the biosecurity annex level 4 in Wuhan. Why wouldn't we ask him, how many times did you go to Wuhan? How carefully did you work with the Chinese? The lab that created the virus and the man and the company that created the first vaccine with the US, they're all working together. This is a biopharmaceutical complex. This actually is a crime. It is a crime. And people are numb to this mind-blowing reality that a virus could be engineered, then ultimately infect the entire world and get people sick. And that a vaccine is coded for the lethal part of the virus, the spike protein. That we would actually create the genetic code for the lethal part of the virus and then inject that genetic code into the human body. Everybody should be alarmed with that notion. I'm going to follow this outline, make a few points with respect to each one of these bullets. For new biologic products, we should always have safety, safety, safety. If it's not safe, it doesn't matter how big the public health need is. It doesn't matter how therapeutically wonderful it is. Richard Barron, who is the former CEO of the American Board of Internal Medicine, who's just stepped down, on his website, the ABIM website, had a statement, it's still up there today. He said, 6,000 people have died after the vaccine. Well, look how many people died of COVID in comparison. Like he's going to trade off these different lives. No, we don't act that way in medicine. We don't trade off lives of people walking into a vaccine center because other people are dying of a respiratory illness. That's not the type of trade-off we would ever accept from anybody in any board, particularly the American Board of Internal Medicine, which actually has a responsibility for credentialing the largest number of physicians in America. I published an op-ed in The Hill in 2020, in August of 2020, before these vaccines came out. By invitation, I was asked to write in The Hill a series of op-eds, and Scott Atlas from Stanford was asked as well. Scott and I were writing. Look at the title of this, The Great Gamble of These Vaccines. How did I know it's a gamble? Because it's the genetic code for the lethal part of the virus. How are we going to shut off the genetic code? How are we going to control where it goes in the body? How come I'm the only person in academia who could see this and put it in writing? There's not a single editorial, there's not a single op-ed anywhere that actually brings up these points. The complete oblivion to what was going on is astonishing. By 2021, we were seeing alarming things happen. I worked with 57 authors, 17 countries, took months to get this paper together. We sent it to every single government that was administering vaccines, and we said, listen, we've got serious questions on safety. Here are all the questions on safety. And I won't read them off to you, but I can tell you, I'm going to show you this in the next several slides. From the very beginning, these vaccines should have been strongly questioned by any doctor worth their salt based on these considerations. There should have never been a presumption by any medical school or any academic medical center that these would be safe. And remember, we always discuss safety before efficacy, always. The presumption that they were safe, and then the even more tenuous presumption that they would work was ridiculous. And it was done by every single dean of every single medical school in the United States. Shame on them. Shame on them for not having the insight and the courage and the intellectual strength to just question this entire endeavor. The safety review has been a disaster. Normally, the VAERS system per year, which records hundreds of millions of vaccines administered, that's what it's accounting for, records 150 deaths. It can happen. Someone can die after they take a vaccine, whether it's related or not, or have an anaphylactic reaction. 150 per year. Look what happened in 2021. It's off the Richter scale. This paper is from April of 2021. By April of 2021, it was off the Richter scale, adverse events and vaccines. And it wasn't because that many people received COVID vaccines. By this point in time, maybe 60 million Americans received vaccines. The majority of data in the database is actually the flu shot and tetanus boosters. Here's an update now. And this is the Open VAERS data overlay. And I've toggled over to Americans, just Americans only. 18,188 people have died after taking a COVID-19 vaccine. Of them, 1,150 on the same day they take the shot. Some people in the vaccine center. Now, we just heard a lecture from a professor from TCU who's concerned about euthanasia and people dying near the end of life. Boy, I hope TCU and all of their professors and their leadership and UT Southwestern is really concerned about 1,150 Americans dying in vaccine centers or a few hours afterwards. Where is the alarm? Where is the alarm? I'm not hearing it. In fact, these medical schools advise their students and their faculty to take these vaccines with no concern over safety. They told the nurses to take them and the technicians to take them. Some of them would not let people attend classes if they took these vaccines, and yet people were dying in the vaccine center. I want to talk to them. I want to talk to every one of these medical school leaders. What was in their minds? Have they even begun to think about how they're going to apologize for this? How are they going to pick up the pieces of this? And then you can see the other adverse events, hundreds of thousands of people hospitalized. And it's strongly associated to when they take the shots. And this is a gross underreporting. In the footnotes there, the FDA Advisory Committee has roundabout in the testimony accepted an underreporting factor of 35. 35, meaning unless we have the vaccine card, unless we have all the data, these are underreported by 35. That means the real number of Americans who've probably died after taking one of these vaccines is over 636,000 Americans that have died in the last 3 years. We've heard lectures concerned about abortions, concerned about brain dead, concerned about euthanasia in the elderly. Where's the concern over 636,000 Americans dying after a vaccine? Under our watch. You can see the lack of recognition, the cloudiness to this. What we know is, fortunately, probably about 30% of people are fine who took these shots. In these data from Schmeling and colleagues, 32.1% of the doses, 0 side effects, not even a sore arm. It looks like nothing happens. Another 2/3 have some modest side effects, and it's 4.2%. The side effect rate is quite high. The batches are not the same. And the same analysis has been done in the United States. Senator Ron Johnson has submitted to the CDC. The batches of vaccines are not the same. And I recognize some of you took these vaccines early because you didn't know or you had to. Well, boy, if I was you, I'd be looking up my batch number on howbadismybatch.com. So you need to know your worry level of what's going to happen. This is very, very important. The batches are not the same. There is a quality problem with these vaccines. Now, the leading thinking is that probably some vials have hyperconcentrated messenger RNA, aggregation of lipid nanoparticles. There's been reports of contamination of cDNA, which in a recent report from the Canadian medical authorities suggests that's related to side effects. And then the Japanese have returned millions of vials due to impurities. Americans have not returned that. Pfizer says they do 40 inspections of each vial, but they haven't produced a single inspection report. Moderna doesn't even say they inspect it. The FDA has said they've never inspected the vials. We're 3 years into this. Where's the FDA contractors and others to inspect for quality, purity, and safety? We inspect Tylenol, for crying out loud. No inspections of COVID-19 vaccines mass administered to Americans. The news on the vaccines every day is bad. There's not a single piece of good news since they've come out. 4 major areas of proven damage to the body with these vaccines: cardiovascular, neurologic, hematologic, and immunologic. Emerging 5th area is cancer. Now that's emerging. But these 4 are proven. You don't even have to go beyond public figures. You don't. Cardiovascular, myocarditis, Bruce Arians pushing the vaccine, former Tampa Bay Bucks coach. He gets to spend last fall in the hospital with myocarditis. Neurological. How about Justin Bieber's wife? Blood clot to the brain. How about Jamie Foxx? I know Jamie Foxx. Stroke. Hematological, blood clots. How about weatherman Al Roker? Showing everybody he's taking the vaccine, multiple blood clots. My favorite football announcer, Herb Kirkstreet, same thing. These people come out and say they took the vaccine and they get these side effects. How about immunologic? Megyn Kelly just came out and said, hey, I took the vaccines, now I got a autoimmune problem. We're loaded with this. We are loaded with public figures with vaccine side effects. Some of them recognize it, some of them don't. The honest ones who care say they had a side effect. Why? Because they want to warn others. The public figures who are too afraid or too ashamed or can't see it, something is wrong with them. They would want to help others. Of course they would. We have over 3,400 peer-reviewed papers on vaccine injuries, disabilities, and death. The literature is loaded with this, and there's a strong bias against publication of any of these papers. It's very hard to publish a paper on vaccine side effects. Very hard. And yet there's still 3,400. What a proxy for an unsafe product. Look at this one from Harvard, Crossan and colleagues. Messenger RNA is in the human heart 30 days after administration, and there's inflammation around it. Now, their stain for the spike protein didn't come out well, but chances are this would have stained intensively for spike protein. The messenger RNA coding for the Wuhan Spike protein should not be in the human heart. It doesn't take much to imagine that this is going to cause a problem, like a cardiac arrhythmia. When the spike protein is stained in the human heart, and these are young men who are hospitalized in Germany, the spike protein is in the human heart, but it's in small areas. Small areas. This may be missed on slicing at the time of an autopsy, but it's there. There's no doubt about it. We should not have inflammatory spike protein or synthetic messenger RNA in the human heart of anyone. Of anyone. Now this paper just came in Schreckenberg. Rat cardiomyocytes, and they actually incubate them with Pfizer, Moderna, and they uniformly get sick. The cardiomyocytes start to have abnormal contractile patterns and abnormal depolarization and repolarization patterns. This is a strongly positive cardiotoxicity study. If this study would have been done in preclinical development for a drug, the drug would have been killed. The company would have said, no, we're not going to advance this drug. It's going to cause people to probably have arrhythmias, cardiac death, or heart failure. A cardiotoxicity study like this kills a drug program. But sadly, it's done after the vaccines are out, when we are trying to put together what is an ongoing biological safety disaster. Look at this paper. And there's authors from UT Houston on this paper. 700 patients who took the vaccine versus 300 who didn't. And there's night and day difference in the cardiac PET, cardiac positron emission tomography. I'm a cardiologist. I can explain this. The heart normally relies on free fatty acids for its fuel. But when the heart is diseased or ischemic, those segments preferentially take up 18-fluorodeoxyglucose. A diseased pattern picks up 18-FGG. Look at these scans. So you can see here, the normal PET is on the left, where there's no red uptake. That's what a normal cardiac PET should look like in someone who didn't take the vaccine. Look on the right. It's staining intensely red for the left ventricle. This occurred nearly uniformly in everybody who took the shot, out to 6 months. Then they would take another shot. I am telling you, we are nearly certain virtually everyone who took the shot, the hearts are not the same, at least for 6 months. Now the question is, in who do we really worry? In who do we really worry? Now, it turns out, this is an interesting finding, 65% of people had a sore arm, but of those who had a sore arm, they had much more intense uptake of positron, of 18-FDG. An autopsy study by Schwab showed the inflammation in the arm looked very similar to the inflammation in the heart. So one of the things I always ask all my patients, they say, should I worry? I said, well, did you have a sore arm to begin with? Let's just kind of start from the beginning. It looks like there's several studies to suggest a sore arm and the early features may be a proxy for who had a higher risk batch versus those who didn't. This paper from Harvard showing kids in the hospital with myocarditis. Nobody should be in the hospital with myocarditis. No one. No vaccine should wind American kids up in the hospital with myocarditis. It's wrong. But here we are. Here's a paper, Circulation, our best cardiology research journal. American kids hospitalized with COVID vaccine myocarditis. The interesting finding is that those with myocarditis are producing tons of spike protein, but the antibody is not neutralizing it. And the kids who are fine are producing spike protein, but the antibodies are appropriately neutralizing it. So there's a mismatch between the library of antibodies that's raised in kids with and without myocarditis. The point is, these vaccines are given with no caution at all for damage to the human body. And early on, I was on national TV dozens of times from the very beginning. Someone reminded me of this today. I told people from the very beginning, under age 50, no one should take these. In the McCullough protocol, which is the first treatment protocol, we didn't even treat people under 50. We sure as heck wouldn't give them a vaccine because we wouldn't treat them because it's mild. We just wouldn't do it. But within a few months, we knew these vaccines weren't safe for anybody. Here's another paper, Rose and myself. People develop myocarditis on the first shot, the second shot, the third shot. It's like a Russian roulette. Keep taking these shots. If someone is following the US government instructions right now from the CDC and FDA, they're on their 9th shot. 9th. I did a Twitter poll. I asked on Twitter, I said, does anybody know somebody's on the 9th shot? I thought there would be nobody. And a bunch of people said, yeah, I do. It turns out about 10% of people say that they know somebody or they're on the 9th shot. Who are they? Canadians and other people who are forced to keep taking these every 6 months for their jobs. They're on 9 shots. This paper from Yale showing the damage to the heart is not repairing in 80%. The cardiac MRIs, when you get to the point of seeing late gadolinium and MRI, you've got a big area of damage. They are not clearing up. Now, normally a small amount of damage, young heart can repair that. The fatal cases started coming in 2021. Fatal myocarditis. Fatal myocarditis should have pulled these off the market. The very first case. Very first case was actually from WashU in St. Louis by Verma. But look at this one from Choi. This is really, I think really makes the point. 22-year-old man, he's perfectly healthy. 5 days after Pfizer, he goes to the hospital and he dies 7 hours later, despite all the resuscitative measures. His heart is destroyed with inflammation. The conduction system, everything, gone. They can't save him. The hospital can't save a 22-year-old young man. These two boys didn't even get a chance. 16 and 17 days, 3 and 4 after Pfizer, they die in their bed at home. The parents are horrified. They call for autopsies. The Connecticut coroner calls in University of Michigan, University of Minnesota. They all look at the slides. They conclude it's fatal Pfizer COVID-19 vaccine-induced myocarditis. To this day, our CDC says that myocarditis is rare and mild, and yet these fatal cases are being reported. Who do we trust? The medical literature, to me, looks pretty straightforward. About 48 hours ago, a very prominent pastor, Andrew Dunnigan, senior pastor of Highland Park Presbyterian Church. That church looked for over a year to find the pastor who was going to carry them for decades. He died in his sleep. His wife rolled over, and this 44-year-old, perfectly fit, healthy man was cold and dead. We are now seeing cardiac arrests 2 years after taking these shots. 2 years. The press release today said he died of natural causes. Do you know that this term died of natural causes has been extended down to 5-year-olds and 7-year-olds? Natural causes? She was smart. Fabian Trump, Swiss marathoner, takes 3 Pfizers, says, I got myocarditis. The guidelines in cardiology say we do not let athletes exercise with myocarditis because it will provoke sudden death. She says, I'm not running. Guess what? She's still not running. She's still not running, but she's alive. She made the right decision. The vaccine causes heart damage now. It should be unequivocal. We have now seen cardiac arrests with documented myocarditis and with no documented myocarditis because of these changes, these cardiotoxic changes seen in the heart muscle cells. Now, when there is myocarditis, about half are symptomatic. We can hospitalize them. We can identify it. The areas of late gadolinium enhancement can be extensive, especially in young people on MRI. The athletic competition triggers sudden death. By the way, the 2 times of sudden death is athletic competition and 3 a.m. to 6 a.m. like Dunnigan. What happens? A surge of adrenaline in both time periods during normal waking is what's causing the sudden death. The case really to watch is Oscar Cabrera Adames. He's a basketball player. He played in a college in the United States. He's from Dominican. He plays in Spain. He doesn't want to take the vaccines. He comes out and says, I don't want to take them. He's forced to take it to play in Spain. He has a cardiac arrest on the court, and they resuscitate him. He tweets out, I got myocarditis from the vaccine, so it's clear. He's out of basketball for 2 years. He's trying to come back. There he is. That's his last picture alive on a medical stress test down in Santo Domingo, and he dies on the treadmill. He dies on the treadmill, clearly documented 2 years after taking the shots. 2 years. There is no other explanation for the massive numbers of sudden deaths that we are witnessing all over the world. All-cause mortality is skyrocketing. There is no other explanation. It is clear the COVID-19 vaccine is responsible for excess death. The vaccine that was designed to deliver us from COVID, in fact, has made things far worse because we can't possibly know who's going to be the next victim. Some of these deaths, these people are the picture of health, like Brian Dunnigan, like Adames. But it gets worse. It's not just cardiac issues, it's prothrombotic. Look at this paper from China. 1.5 million people took the shots. 700,000 took the shots, 1.5 million who didn't. And they identify after 2 shots a 4-fold increased rate of arterial and venous embolism in the retinal vessels, in the back of the eye. Now, these aren't in situ formation. These are coming elsewhere. Now, the absolute rates aren't high, but people who take the shots are prothrombotic. We are seeing in our office people coming in with blood clots 2 years after taking these shots. So without protection from the pharmaceutical laws, these should have been pulled off the market literally within days or a few weeks of being released. There's even some analyses suggesting that, Pfizer actually knew about excess deaths that weren't reported in the briefing booklet to the FDA, that Pfizer should have never been approved. These were not safe from the very beginning. But when Pfizer held back and didn't want to release their 90-day dossier, and the FDA tried to block this to you, the American public, we knew something was up. The FDA said, no, you can't see this for 55 years. What were they hiding? 1,223 deaths within 90 days of Pfizer. People were dying. Their family members were calling Pfizer. Pfizer was recording all the vignettes. This was in December of 2020, January of 2021. They were dying. And yet medical schools like TCU, like Southwestern, they were encouraging their students, residents, fellows, and nurses and attendings to take these shots while Pfizer was recording these deaths. Still have not seen a single alarming look of concern from anybody at a medical school. We gathered up all the autopsies that had ever been published using Prisma technology, using standard search terms, and then independent adjudicated review, submitted it to Lancet. Lancet on the preprint server censored this after 24 hours of record downloads. We concluded 74% of these autopsies clearly showed the vaccine was contributing to or causing the death. That's from the available autopsies. And some of these were early. I can tell you the ones where the vaccines didn't cause the death were people who were at the very end of life in a hospice center or nursing home. Somehow they got a vaccine and they died of their original illness, and we didn't adjudicate them as the vaccine. But it was clear the vaccine is the proximate cause of death. Most of the deaths are cardiovascular that's occurring after COVID-19 vaccination. Do you know the consent form doesn't warn somebody that they can die of a fatal heart condition on the consent form or a fatal blood clot? They're not safe. They're not safe. And it's your responsibility to talk to each and every one of your patients, your colleagues, and others and tell them it's not safe. It's your responsibility to report to your colleges. I've reported to the American College of Cardiology. I've helped others, American College of Obstetrics and Gynecology. These aren't safe. They're not safe products. They never will be safe. They're not getting any safer. So this idea, the longer you're silent and the longer your colleagues are silent, the more harm potentially is done. World Council for Health got it right. June 11th, 2023, they said take them off the market. They analyzed 39 safety databases worldwide, the 4 major ones, and the signals are the same. Worldwide, these vaccines are not safe. AAPS got it right. March 21, 2023, this is what AAPS said. Look at number 10. Get them off the market. They're not safe. You should be proud that this is the only physician organization in America to call it right. They're not safe. And look when this came out, March of 2023. This organization gave it plenty of time. It's not like we were misreading the data. There's plenty of time here. They're not safe. In the US Senate, December 7th, 2022, and then the European Parliament, I told people clearly they're not safe. I've rendered my opinion as a doctor, and I'm entitled to do that, and so are you. What do the vaccines do anyway? It turned out there was 4 false claims. The first one is they prevent infection with the current strains. No, they prevented infection with the original strains, and that effect size was probably overestimated. But in the current strains, they're not even tested on humans. The BA4, BA5 booster came out based on animal data. And now the XBB 1.5%, they can't make a claim that this is reducing human infection because it wasn't studied. They don't stop transmission. Our CDC director came out and said they don't stop transmission. That should be full stop. And they don't reduce hospitalization and death. It's very important. In order to make a hospitalization and death claim, there must be a prospective, double-blind, randomized, placebo-controlled trial that showed that. Not a one showed that. There's not one that's even trending towards showing that. And they're not going to prevent an outbreak occurrence. Now, fortunately, our fall outbreak is on the way down now. This current outbreak led by EG5, FL1.5, and HV is on the way down. I haven't had somebody in the hospital with COVID in well over 2 years. And some of the, Dr. Eck and some of the big treating doctors are in this room. This pandemic has effectively been over with a long time ago. Why are there so many papers saying the vaccines work? Why? Fung and colleagues analyzed this. Peter Doshi, associate editor of British Medical Journal. It's because the virus mutated and it's more benign. So milder mutations as more people got vaccinated over time. Hospital EMRs have the default of being unvaccinated. So they were falsely claiming it's a crisis on the unvaccinated because that's what the EMR said, because they weren't fairly identifying who took the vaccine. No linkage to the CDC vaccine data in almost all the US studies, no control over early treatment and natural immunity. Those are the things that really influence the risk of hospitalization. No adjudication for hospital COVID illness. So people could be in with an ankle sprain, and remember, somebody tests positive for COVID for about 6 months after they had it. So this idea of, oh, someone's positive for COVID, the first question is, do they have any symptoms related to COVID? And then the last one is conflict of interest. Every single paper that declares the vaccines are beneficial in work, the institutions favored the vaccines, mandated the vaccines, encouraged them. The doctors who wrote those papers took the vaccines, and they have the psychological belief the vaccines are safe. They want to believe they're safe. Who wouldn't? They took the shots. They psychologically want to believe they're okay. Who wouldn't want to? But that's called conflict of interest. That's called bias. They're investigator bias. They took the shots. There's not a single person who took the shot who's writing a paper that says the vaccines are safe that is free of bias. Now, someone who didn't take the shot, they could have or they could have not, you can be free of bias. You know, if you do not have brain cancer, you can actually do research on brain cancer and be unbiased. But the minute you have brain cancer, I guarantee you're going to have a bias. It's the same thing with these vaccines. It's a vaccine ideology. Very few people who've taken the vaccines can say, wow, I made a mistake, I'm really worried. Certainly in the academic world. What does the consent form say the vaccines do? It says past tense, the only benefit of the vaccine has been shown in the past to prevent COVID. The consent form makes no claim that it reduces severity of illness or reduces hospitalization and death. So every time there's been an FDA or CDC official or a commercial or anyone that says the vaccines reduce severity, it's a false claim. Because if it was a valid claim, it would be in the consent form. Now, the Omicron variant that came out in December of 2021 broke through natural and vaccine immunity because it's so resistant to any form of vaccine, but it's a very mild strain. There's 2 papers from Japan that have analyzed this. They think this Omicron is so different that it actually was manipulated in a lab, believe it or not. But fortunately, it's milder. But what we know in data that does fairly link to the vaccine administration data sets is horrendous. Look at this UK. Across the board, the vaccinated do far worse than the unvaccinated. So for those of you who did not take the vaccine, you made the right choice. It's clear. Now in the United States and in so many places, we don't have access to the CDC vaccine administration data, so we can't do our own research like we can do in the UK. A blockbuster drug used to be $1 billion in sales after about 15 years of development, about $500 million in investment. With no development costs, no sales and marketing, Pfizer and Moderna looking at $100 billion of revenue, 100x. The money has to be playing a role in what appears to be widespread malfeasance and corruption. It has to be. Whether you're vaccinated or not, everyone would agree a sick patient needs treatment. That's the reason why I told the Texas Senate, where's the focus on sick people? Doesn't matter if they took a vaccine isn't treatment. Masks aren't a treatment. Hand sanitizer is not a treatment. Treatment is treatment. And people kept going back to the vaccine. It turns out the vast majority of public health effort worldwide was on things that were completely useless. Social distancing, lockdowns, masks, and vaccines. All the investment should have been on treatment. If we've learned anything about pandemics, and we've been told more pandemics are coming, we better be laser focused on treatment and not waste our time on useless things. Remember, the whole premise of wearing a mask is that you wouldn't get COVID. What a ridiculous presupposition that was. Everyone got COVID. I read Scott Atlas's book. Apparently, according to Scott Atlas, for 9 months, Scott Atlas and Mark Meadows and Trump and everybody, they met over and over and over again. And they discussed what? masks and lockdowns over and over again. In Scott Atlas's book, there's not a single mention of treating a sick patient. Lesson learned, get some doctors in Washington who know how to treat patients, and let's stop this bull. You know, I told Marjorie Taylor Greene's group in the office, I said, you still have yet to have a doctor who's actually seen COVID patients go and talk to anybody in the House of Representatives. We're 4 years into this. This is ridiculous. 2 papers I was very proud to be involved in. Many of you are authors, where we said, listen, we can treat this. We can treat this. It's not going to treat everybody. It's a mass casualty event. This is now years ago. We need drugs with signals of benefit, acceptable safety. We're going to use combination drugs. There's never a miracle pill. We don't have time for large-scale, multi-drug, randomized placebo-controlled trials. We're 4 years into it. There still hasn't been a single large-scale, multi-drug clinical trial. We're not going to have them. COVID-19 was a test of courage, of intellectual courage and clinical acumen. And the best clinicians in the country stepped forward and did their best to save patients. And those who were less adequate, they stepped back. This was a giant separator. All of you who treated COVID can feel extraordinarily confident that you're a superior clinician and you did far more than your counterparts who stepped back and let the virus just ravage their patients. There were 3 major parts to this syndrome: viral replication, cytokine injury, and thrombosis. When people were in the hospital, they were dying of blood clots. It was too late to give antivirals by and large. And there was a whole series of things we could do. But as we sit here today, everything that worked in this illness was actively undermined by our federal agencies, including nasal sprays were undermined. Every single company was sued by the Federal Trade Commission, so they couldn't do any research or market a nasal spray. And then hydroxychloroquine, ivermectin, even Paxlovid and molnupiravir were undermined. They were. Monoclonal antibodies, you couldn't get them. Colchicine, budesonide. Every part of treatment was undermined, whether it was cheap or expensive. In our book, we call this out. It was intentional. Undermining treatment and never mentioning treatment was a method to enhance fear and suffering and hospitalization and death in order to prepare the world for mass vaccination. Because this suppression of early treatment was global, and it involved everything. It wasn't about money per se. Even monoclonal antibodies were hard to get, and they were always safe and effective. The nasal sprays are probably the most mind-boggling part of this. The reason why I'm focusing on the nasal sprays, and virtually everything works, by the way, in a nasal spray. This is a homemade nasal spray from my kitchen countertop, just a few drops of iodine and salt water. Because nasal sprays will be our first line of defense in the next pandemic. Now, Anthony Fauci, Tedros at the WHO, Bill Gates, and vaccine frontman Peter Hotez, all with great enthusiasm, say there's going to be another pandemic and that COVID is just a warm-up. Well, what do they all have in common? They're part of this biopharmaceutical complex. They're part of this vaccine syndicate. They are so lathered up to advance more vaccines. Well, how are you going to protect yourself? You're going to protect yourself with virucidal nasal sprays and washes, and the randomized trials are as good as you're going to find. This one by Chowdhury and colleagues. Look at this, 606 people. They all have COVID. They're randomized to an active iodine nasal spray and gargle every 4 hours versus a control group, which is just an inactive solution. And PCR rates drop by day 3. This was the answer, by the way. If we ever wanted to reduce the spread of the illness, everybody should have been outfitted with nasal sprays and gargles. That would have been the government intervention, safe and effective, and didn't have to be iodine. It could be any other solution that has been tested has worked out. Even need for oxygenation and hospitalization were less. Nancy Mace, Republican Congresswoman, went nuts. She said, why is our government not telling us about how to defend ourselves? This was so simple in 2021. It turned out the government behind the scenes was suing every company that made these products. They still have lawsuits. They still haven't been able to do any research. Look at the available studies, 20 total studies, 17 clinical trials. They're all positive. Everybody here should have a nasal spray and gargle ready to go. Iodine base is perfectly fine. Here's xylitol. Xylitol, a lot of products use xylitol as a base. Here, there was a 71% lower rate of actually just even getting COVID if you use a xylitol nasal spray post-exposure. Why did we use hydroxychloroquine and ivermectin? Well, early on, we didn't have anything else, and the FDA says we should use drugs off their original advertising labels when we're fulfilling an unmet need, and that's what we're doing today. AAPS can be very proud of the fact by October of 2020, they had a home treatment guide. No other physician organization or the NIH or the FDA or the CDC or the IDSA had a approach of how to treat sick patients at home to avoid hospitalization and death, but AAPS had it. Should be very, very proud of this home treatment guide. We knew by December of 2020, we had clear and convincing evidence that early treatment was working. It wasn't about a specific drug, just using 4 to 6 drugs in combination, as well as the nasal sprays and gargles, it was working. We could get, most of you have treated people in their 90s. We can get people through the illness. It was only those who were untreated that ended up in the hospital or worse. Now, essentially, the acute phase of the pandemic is over with, and we're dealing with stable patients in the office with long COVID or post-vaccine syndromes. It's very important. That's what we're dealing with now. Everyone's shaking their heads. What do we know? This paper from Germany, 48,000 Germans. 70% of people with long COVID have been vaccinated multiple times. So we're not going to be able to sort this out. It turns out in their analysis, those who are vaccinated have way worse long COVID than unvaccinated, probably because the body is loaded with this spike protein. This paper by Pari and colleagues from Australia has nailed it. People after COVID and after the vaccine, their body is loaded with this spike protein. It cannot be broken down by human peptidases. It's stuck in every cell and it's stuck in every tissue. It's everywhere. Perry points out that the messenger RNA is long lasting, the spike protein is even longer lasting, and it goes everywhere in the body. Brogna and colleagues from Germany uses mass spec. They can identify the spike protein specifically that comes from the vaccine and not the infection. Very important. It's got a proline signature on it. It's full length spike, S1 and S2, held in the pre-fusion conformation. Brogna found this circulating in the bloodstream of the vaccinated for 6 months. And then they take another shot. Can you imagine people walking around with circulating Wuhan Spike protein in their blood from taking these shots? That's what they found in at least half of people who took them. The spike protein is fundamentally the cause of a new genre of disease in countries like ours. 75% of Americans took the shot. Fortunately, 25% didn't. A proposal is what's called McCullough protocol base spike protein detoxification. That is attacking the spike protein with nattokinase and bromelain that are two natural enzymes available as capsules to break down the spike protein, allow the body to clear it, manage inflammation with curcumin, another natural substance. Hydroxychloroquine doesn't break down spike. Neither does ivermectin. Neither does prednisone. Neither does colchicine. Neither does nicotine. Neither does low-dose naltrexone. All the things that you've tried for long COVID, as I have, are just managing symptoms. It's not managing the problem. Base spike protein detoxification is a proposal to handle the problem. Now, we have randomized trial data with curcumin, looks very positive, none yet with nattokinase and bromelain. But these are the suggested doses. This is what we're doing in our practice. We've been working on this for over a year. We are seeing patients get better slowly. It's very slow. We add other drugs to it. I just held a call with doctors in the UK, hundreds of doctors that are all getting the conclusion, the inference that their patients are getting better with detoxification. Now, when I came out with this and I published it in the Journal of American Physician and Surgeons, I was immediately censored all over social media. You can't do this. You can't treat long COVID patients. You can't do this, Dr. McCullough. It was identical to what I was told when I published my first my paper on treatment. You can't treat patients with COVID. The censorship was confirmation that we were on the right track. It's true. If I would have said, listen, drink juju juice, nobody would have cared. But they really care when you hit something that really matters. So give it a shot. What do we know about natural immunity? Most important paper to quote is by Chin and colleagues. 59,000 prisoners, 16,000 staff. Once you're through Omicron and Delta, zero risk of hospitalization and death. Zero. Zero. And believe me, the prisoners want to get out of jail and go to the hospital. Zero risk. This is the new risk stratification. If someone calls you with COVID, first thing you ask them is, have you had it before? If you've had it before, there is a zero risk of hospitalization and death. My mom, an independent living here in Dallas, just had COVID this last summer, but it was their second time, treated with nasal sprays and gargles, no prescription drugs. I want to quickly move into and touch on this parallel epidemic we're seeing between autism and transgenderism. It's real. There are now building 200 papers now in the field of autism developing under age 4, indicating dysregulation of the immune system. We know that there's been an acceleration of the vaccine schedule with no attention to safety of the combined products. None of these products have undergone extensive safety testing. And now we had very good data from one study demonstrating that once we got to multiple vaccines in combination, the rates of autism began to come up in the United States. We don't know what's causing autism, but I can tell you when I was a kid, it was 1 in 10,000. Now it's 1 in 36. The biggest change that's occurred with the immune system is hypervaccination of our children. When I was born, there were 5 shots. A kid today faces 108 shots. When the ACIP panel for the CDC put COVID vaccines in the schedule, that was the tipping point. The children who do not have medical necessity, do not have a clinical indication, that have largely been through COVID, have no theoretical benefit of the vaccines, could only be harmed. Now the World Council for Health is telling us, take a wait and see attitude on these vaccines. No vaccines. We've got 5 studies, Mawson, Hooker, Miller, Thomas, and an Amish study showing going natural with no shots during childhood, better outcomes. Lower rates of asthma, allergic dermatitis, need for tympanostomy tubes, lower rates of attention deficit disorder, Asperger's disease, and autism. It's safer to take no shots based on contemporary analyses. What about LGBT? Turns out those people going forward for transgender surgery tend to have autism. Multiple studies show it. Transgender medicine, as been pointed out, transgender programs increase the burden of psychiatric care. They don't reduce it, they increase it. This paper in JAMA, transgender medicine increases mortality for homicide, suicide, and other causes. Transgender medicine is bad medicine, period. Period. And it should have been banned everywhere. We shouldn't even have a ban because no ethical doctor would perform bad medicine. Censorship. This is the reason why a lot of us are here. We've seen medical freedom violated, social freedoms, economic freedoms. I want to point out to you that one of our own members, Denise Sibley, as we sit here today, is undergoing the final appeal for her board certification with the American Board of Internal Medicine. It's going on right now. Denise Sibley worked with Tennessee legislators to improve ivermectin accessibility. It was all done legally. It was all done above board. And all she did was take care of her patients, and they're trying to strip away her board certification. She's an AOA graduate from University of Virginia. Next up is going to be me and Pierre Corey and Paul Merrick. This is by the American Board of Internal Medicine, which was actively working with Pfizer and Moderna throughout the campaign. And this is all out in the open. A corrupt accrediting body whose only purpose is to make sure we pass the tests and we've completed our training. Instead, they are hunting people for what they are calling misinformation. And anytime you hear the word misinformation, I want you to recognize misinformation is a classic propaganda technique. Misinformation and disinformation. In our field, there's simply emerging scientific data and multiple points of view. No one holds the truth and therefore can accuse somebody of misinformation. It's not possible. It doesn't exist. Misinformation and disinformation equals propaganda. It means people are trying to push their agenda. Do you know Northwestern University, my former residency alma mater, University of Washington, Stanford, they're all having entire meetings like this on misinformation. They are having meetings on propaganda techniques. Misinformation came into the English literature in about 1500, was popularized during Nazi Germany by the Office of Propaganda under Hitler, Goebbels. And then in 2018 was Word of the Year by Washington Post, used in partisan politics. Now misinformation is the most common word on medical society websites. They are engaged in a form of propaganda. So to finish and conclude, the pandemic has been a global disaster. The safety profile now with these vaccines is known as expected. The limitations of theoretical efficacy are also fully disclosed. The pre-hospital phase was always the opportunity for early treatment. We have twin epidemics of autism and related transgenderism. The vast majority of kids volunteering their bodies to change gender have autism or autism spectrum disorder. You have to realize that they are being preyed upon and they are being indoctrinated. Censorship and reprisal is working to crush our freedom of speech, scientific discourse, and medical progress. Everybody concerned about any of the topics this morning should be equally concerned about this vaccine ideology and agenda. What we've done today is we kind of weighed out the evidence, the country's fates in the background, and we have to roar like a lion. I really do. I think we have to. Now's our time. I told Tucker Carlson, he said, gosh, he goes, was it worth it? I said, listen, Tucker, I said, if I helped one person, it was worth it. Let's drop all these vaccine mandates. Let's prohibit all forms of pressure, coercion, threat of vital. Ban all forms of vaccine discrimination. Let's pause these vaccines, get them off the market. Begin vaccine injury treatment centers. Pivot to early treatment if we need it. And let's ban all transgender medicine in our youth across the United States. I'm Dr. Peter McCullough. Thank you so much for having me.